Welcome again to the National Swimming Pool Foundation World Aquatic Health Conference. My name is Allison Zawoski, and I will be your moderator for this morning's session. I just want to remind everybody to please turn their cell phones to vibrate or off during the session so we won't be interrupted. And I just want to remind you that we do have 2 emergency exits. If you do need to use the restroom or anything, there is one located across the hallway. Also, there should be no audio recording or video devices. They are not allowed during the session. And I would like to thank our sponsor, DuPont, for the session. And with no further ado, I would like to welcome Kim Burgess, our speaker, who will be speaking this morning on the National Drowning Prevention Alliance, a national approach to drowning prevention. And she is coming to us from Florida, where she has done much research in Broward County. Broward County.
Yeah, I'm on. You're good. Okay, now, yours is off, right? Okay. Now, we've had some technical difficulties. There it goes. Yay. Okay, first, thank you all for coming out early this morning. Does this seem a little loud? It does to me. Okay. I need those things in my ears, I guess. The National Drowning Prevention Alliance pretty much is an alliance of trying to bring everybody together to ultimately eliminate drowning. It can't be done with one person. It can't be done with one organization. It takes everybody doing this because it affects everybody. And it affects from infant and toddlers all the way up to seniors, and we can't just focus on one area. We got to try and focus on every area. And so what we're trying to do is see the big picture and then help put the pieces of the puzzle together with all of you folks. And what I'm going to share with you is some of the initiatives that we're doing, and hopefully it will inspire and empower you to go back into your communities and do the same thing. And so just a little background on the NDPA. We'll start, if this works, there we go. Well, that's what we're doing. We're going out. We have the resources for you guys if you need it. It's free of charge to you. Go to our website. We have the resources here. Download them, whatever you need to get the outreach in. Because like anything and everything, drowning prevention, water safety education, it's all about getting information into the hands of the parents. So you sort of think of you guys as the instructor trainers, and you're going out and doing the instruction, and the what do you call that, domino effect just keeps going. So if we can get you guys inspired to go out and work in your communities like what we're doing, then especially in these hot pockets, Florida, Texas, Arizona, California, and Pennsylvania is up there in the top 5. Especially in those areas where the drownings are really occurring. And then, I'll go on to that. But we started in 2002. DND Technologies. They are a gate and fence lock company, and it was their idea to stop the drownings. And so we started back in 2002, sort of as a I don't want to say pool fence company, but they sort of started, that was their focus, was pool fence, pool fence, pool fence. Well, we've sort of expanded our reach from there. We're not backyard pool fence only anymore because that's not the be-all, end-all. It's just one of the barriers. It's not the only barrier. There are many more. So we've now grown. We have sponsorships. We have membership. And we've partnered, I think, with most of the national organizations around the country who focus on water safety or drowning prevention. We've adopted the Safer 3. I don't know if you guys are familiar. I think you are. We've not adopted the Safer 3 program. We've adopted the Safer 3 message, which is different. The message, we think, and I don't know who's all in there from Safer 3, but the differences that are in safer. Because if you think about it, there is really no such thing as safe, especially if you're dealing with in, on, around, about water. All you can do is be safer. And then the more barriers you have in place, the safer you're going to be. So the R represents that risk. And I think if we start using that terminology of safer rather than safe, it's a psychological. I don't know if Peter's in here. He's got a psychology background. It's a psychological thing, because if you put a fence up, you're not safe. If you have swim lessons, you're not safe. So if if you're on a boat and you don't have a life jacket, just because you're on a boat, you're not safe. So there is really no such thing as safe. It's safer. And if we can get that, these little verbiage, psychological things that we say in our messaging when we're talking to the press, or when you're doing your media packets, or you're doing your brochures, or whatever it is you're doing, even if you're a fence company, or a pool company that does the nets, or whoever you are, whatever your message is, instead of saying the word like peace of mind, because really parents have children, they shouldn't have a peace of mind. They should try to strive to be safer, because there is no such thing as safe. I was having a conversation with Gwen the other day, and she said let's go back to drown proofing. Well, we can't. There really is no such thing as drown proofing anymore. So we have to be safer. We're never going to be safe. So some of the stuff like this is that if we can come out and share with you the things that we're getting around the country that you guys can help do in your community. So just sort of keep that's our goal here. So we want to implement the strategies to reduce and manage the risk. If you're on a boat, wear a life jacket. Don't drink. Have somewhere to call 911, because we know that the boats, something's going to happen on a boat. It almost always does. And so you're going to have to prepare for an emergency. So I don't know how many deaths occur out on the open water because there were no life jackets and the parents were drinking. So just reducing those two risks. So identify what your risk is. If you're at a family reunion and you're at a park and there's a lake there, somebody has to be designated to watch the water. If you don't hire a lifeguard, then appoint somebody. But if you have children in, on, or around a body of water, then the parent must be responsible for watching that child. It can't be the sole responsibility of a lifeguard. And that's another thing. And I'm going to keep throwing these little isms at you all day long, that we want to recognize. First, in order to, you have to identify the risk and where you're at. And some people get complacent. You have a backyard pool, and you don't have a fence. Your kids have never drowned there, but that doesn't mean that somebody's not going to come into your backyard, or one of your children's not going to fall in and drown in that backyard pool. They're not seeing the backyard pool as a risk, and it really should be a risk. So the safer three: identify your risk, minimize it, safer water, safer response, safer children. So I'm sure Wayne just came in and messed me up. Safer children, safer water, safer response is how it is. So you have children or people in the water. If they're little children, get them lessons. Just go through that process. If it's the water, put a fence up. Swim near a lifeguard. Put a life jacket on. And then, one of my roles in Broward County in Fort Lauderdale is I'm the chair of our child abuse death review team. We see every child death that comes in that's unintentional. This year we reviewed 27 child deaths. 12 of them were drownings. In every single case, not one parent knew CPR. That would be an interesting little, shouldn't we be out there, where's Red Cross? Shouldn't we be out there making sure, or the American Heart Association, that somehow these parents know how to do and perform CPR? We don't know. We're not getting that message out there because not one of these parents, they attempted CPR, but they didn't really know what they were doing. Not one parent had taken a certification course for CPR. Wouldn't you guys like to know if your children are drowning? Isn't that a good thing to ask? Did they know or perform CPR? Because if your child's sitting there, you want somebody performing CPR on that child. Okay, so that's the safer three. The NDPA, and I have a packet here that I'm going to go through with you guys. However, I didn't know how many to print out, and there's a bunch. And so if there's anything that you guys want, all you have to do is go to the ndpa.org website and download it and hit print. Or maybe you don't even have to download it. You could just hit print. But supervision, I know lifeguards are necessary. We need them. But what if every time a child was in the water, a parent was within arm's reach or touch supervision of that child, they would not drown. Now, in Florida, just over the weekend, we had a drowning on one of our cruise ships again. The cruise ship people said the parents were right there. The parents were there. But I get the backstory. The parents were there, but they weren't really there because who pulled the child out of the pool? It wasn't a parent. It was one of the bystanders. So the parents were there, but they had no idea what their child was doing. Constant eyeball supervision within hand's reach. Now, do kids escape from their pool? No, I'm talking about little kids and backyard pools or lakes and canals. Kids escape. And that's where that SAFER 3 comes in. The more barriers you have in place, the door locks, the door alarms, the fences, the children know how to swim, you know CPR, the more of those barriers you have in place, the chances are the child drowning are going to be slim. But that doesn't mean the child's still not going to drown. But you have to have the more barriers in place, the better. Always swim. But I got to tell you, supervision. In Broward County, in most of the cases, the kids were left in the pool for at least 40 minutes. Not 2 minutes or 5 minutes like what you always read, but 40 minutes. That's a big difference. So where was that supervision? Okay. Supervision. We're back to supervision. The physical layers. Now this is, we have, and it's in here. I have it. It's on our website. We have a position paper that we put out, and this is where this is coming from, this layers of protection. I'm going to have to talk to my board about this because I don't even like that term. Because it gives the assumption that if you do all of this, your child's going to be protected. And in reality, they're not. All you can do is be safer. You can never be safe, and you can never really be protected. You have a child, or you're out on the ocean, or you're out in the lake, or you're wherever you are, just because, you still have to be vigilant and watch the child. And like we have in Broward County, we have a little thing that says, don't let your guard down. You have to be the parent, and we have to educate the parent to be the guard. They have to be the own lifeguard for their child. So I would like that to be barriers, layers of barriers or barriers or something. But that layers of protection, we've had so many parents of children who drowned who come up to me and say, oh, but we were protected, we had a fence. I'm sorry, you have a 2-year-old boy, they climb. That's what they do. So we're trying, and all we're saying is the more of these you have up, the safer you're going to be. But just because you have all of these up doesn't mean your child is still not going to drown, or for that matter, anybody. Think about it. Well, I had a lady call me the other day in tears. Her father drowned at one of these senior facilities. There were no guards. There was a maintenance guy there. He wouldn't pull the father out because that wasn't his job. There he is, seeing this guy floating. Well, then at least call 911. But the dad lived for about a week, and they finally pulled the plug. But it's not just children, it's everybody. We have to be more vigilant. And if we're going to have these bodies of water, whether it's a pool or lake or canal, that has to have more and more barriers in place. A lot of people don't think of swim lessons as a layer or a barrier, but we've shown through research over and over again that if a child does have lessons, they're less likely to drown. For many reasons. Not because they're learning to swim, but they're learning why they should not be in the water by themselves. It's like touching a hot stove for the first time. If the child does that and you say, oh, hot, careful, don't touch that, and a child touches it once, they're not going to likely do that again because they've learned. It's the same thing with the pool, even with the 6, 7, 8-month-old. If they get into the water and they're afraid, they're less likely to go in. But they're also learning a life skill. They can learn to maneuver in the water without drowning. Okay, we're still doing this. Other types of water, entrapment. Well, I know that CPSC has done a big job on this entrapment thing. Never swim alone. The father, remember I was talking about the mother, or the child, or the mother, the daughter who called. Her dad was out swimming alone in the pool and had a heart attack. And no one was there. He didn't tell anybody he was swimming. And this is a senior. Risky teens. This happens all the time. That's one section. Even the NDPA and even us down in Broward County and in Florida, we don't address the teens because I don't know. Maybe we don't need to address the teens. I don't know. Chlorine dispensers, life jackets versus toys. We have a position at the NDPA that the water wings are a bad thing. Coast Guard approved life jackets. We've seen too many times where those have deflated, they've fallen off, the child was wearing it, and then the mom took it off, and the child went back in because they thought they could float because they had these things on. And really, with the water wings, what can they really do other than this? So, if you guys, I don't know how many out there are swim instructors, but the water wings really shouldn't be used unless somebody's using them in a classroom situation, in the pool, as a training device. But parents shouldn't rely on their babies in the pool with these things on. Boating carbon monoxide risk, that actually is pretty common in the boating world. This, now listen guys, all this stuff on the table, I want you to take back. Somebody has to take this because I don't want to take it back home with me. We don't have the internet in here, but these DVDs, it's just a 6-minute thing. You can also download it from our website and get it on, but we also have them here, but it's just a 6-minute thing. We have them down at the doctor's offices are playing them, the emergency rooms are playing them, wherever somebody's sitting and waiting, they can use this. It's only 5 minutes, and it goes from the inside of the house to the outside. And it sort of covers just everything that I had just talked about with the door locks, the door alarms, the pool fence, the gates, the windows, and it sort of covers all of that in this video. It's very, very nicely done. Excuse me? A fire rescue guy. A professional fire, thank you, sir. A very good-looking fire rescue guy. So the NDPA, I told you at the beginning, I got a couple programs I'm going to go through, and I only have 40 minutes, so if I talk fast, I'm trying to get through all of this stuff quickly. Sorry. We partnered with the Pool Safely campaign back in 2011, to do a national PR campaign and this is where this was born, among other things. But that was this was as 2012, the number of summer drownings. You see Texas. These are children under the age of 15 and younger. But you see Texas right up there. Our Florida deaths, almost all of them are 3 and younger. They're not the older kids. I don't know why. Here's a program that we've started. Now, this is on your table somewhere. Help me. Thank you. Okay, now we know, this is for the 3 and younger group, right? So Water Smart Babies program. It's on our website. I didn't want to print out everything for everybody. But think about it. It's getting information into the hands of parents via the pediatrician. These booklets only go out to pediatricians. We have, in Broward County, we give about 15,000 of these books out a year. And it's just from the pediatrician. So if you guys are in a community, in every community, especially the bigger counties, they have a pediatric society or a pediatric coalition or pediatricians group. I just called them and said, listen, we've got this idea for a prescription program. Because if you're a parent, who's the most trusted person in your child's life besides you? The pediatrician. If the pediatrician says, you need a prescription for whatever this is, for this rash, as a parent, you're going to go and get that prescription. So we're saying if the pediatrician says, you know what, drowning is a leading cause of unintentional death for children for 1 to 4-year-olds, we think that you need to get your child into lessons, and we give you a prescription for it. It's not really a prescription, but it's pretend. But still, it's the parent, it's the pediatrician signing it saying, this is so important, we think you need to go do this. For your groups out there in Broward County, our Learn to Swim programs for our babies has jumped over 200%. So they're coming and they're getting lessons. Historically, our numbers are very, very high. For some reason, we've been fluctuating. One year we only had 5 or 6 deaths. Last year we had 12. This year we've only had 4. So they're fluctuating for whatever reason. But historically, Broward County has always led the country in drownings. Not real sure why. We're trying to figure that out. But in the last couple years, we haven't even been in the top 5 in the state of Florida. So I've got 2 reasons for that. One of them, I think, is this, because we got more parents who are becoming more aware of the dangers of the pool. And then inside the booklet is every program in Broward County that offers lessons for children. And then, of course, we have our Safer 3, Wayne. We have our Safer 3 message, CPR reference, because remember, what did I tell you? Not one parent knew how to do CPR, and their child died. And in almost all the cases, except 2, the pools were green. So and then we just have a little thing on safety devices. Anyway, this is this one. Okay, from here, we thought, you know what? The pediatricians, the doctors are on board. We need to, if we're educating them and they're bringing this, then we need to let them know why it's so important. And it's not so important because the child's getting in the water, they're bonding with the parent, they're learning how to roll over, and they're learning how to blow bubbles and to get to the side and grab the yellow ducky, and they're doing all this stuff, and it's very good for them. But there's actual scientific benefits to the child when they're moving and learning at the same time. And one of the reasons that it's so important to get the kids in the water from, say, like 6 months to 18 months and then keep them there for a lifetime is because of what's happening in their brain when they're moving and learning at the same time. And the synapses that are created and the cognitive skills that are being developed and the social skills that's being developed. And there's studies in Australia that are showing, just like off the charts, the difference to the kids who are going through these lessons at a young age and the control group that are not going, and the difference in the 2 groups. And the kids over here taking the lessons are better socially, cognitively, coordination, academically, everything, because it's not about them learning how to swim, because at 6, 7, 8 months they don't have the motor skills to learn how to swim, but they're moving and learning and listening to music, and they're doing stuff with their parents in the water. So we have, this is online as well, but we have it out on the tables too, and it just goes through like the top 9 reasons why scientifically. And I can tell you, the pediatricians, our pediatricians now are one of our biggest advocates, and the pediatricians go to PTAs, they go to daycares, they go and they present why it's important for the parents, and they're presenting to the parents. It's way more effective for a pediatrician to go out to a large group and say, we really think your child should do it, than me coming in and saying, you really should do this. They're listening to the pediatrician. So we're working with the Florida Pediatric Society to put a resolution together to get the AAP to adopt this so that this goes out nationally. So that's one of the things. This is something you guys can do. I have the plan if you guys want to get it started, this is my little Bible here. I have the plan that if you guys want to get started, how easy it is to get something like this going. And we get 10,000 booklets printed for like $3,000 or $4,000. So it's a really, I mean, think of the money you spend on advertising for something. You could spend it on a whole lot better getting this type of information right into the parents' hands. So this is our Water Smart Babies program. Let me go on. We've developed standards for this as well. It's online too. If anybody wants to see this afterwards or wants copies, I have all this stuff here, the standards that we've created for this. And it's not just me. I didn't create it. USA Swimming was involved with this, the United States Swim School Association, the Red Cross, the YMCA. Everybody worked on this as a group to put these starfish. Everybody looked at these standards, and then this is what we came up as it's not the only way to learn to swim, but we feel it's a standard that should be taught. Sometimes that's not available. So the NDPA, we have social media, we have Facebook, we have Twitter, we have LinkedIn, we're on AI Connect. We have commercials. Oh, and we do have commercials. If you go on to ndpa.org, feel like a commercial. But if you go onto our YouTube channel, we have commercials that you can use to download them and send them off to your media people. They're free. They're already developed, and you can use them. That way you don't have to recreate the wheel. It's already created for you. And we actually won a couple of, I don't know what some sort of a media, national, I don't remember. There's a national organization for PR, and our commercials actually won a national award for 2012. So I have membership packets on we have a table out here where we had the talk. There's a table, so if there's anything that you need extra, we have them out there as well. But we have our NDPA package. We have a newsletter, so if you decide to become a member, we have a newsletter that gets sent out to everybody. That's what it looks like. Okay, now, NDPA chapters. Here's what we like. How am I doing on time? Oh, good. Okay. The NDPA chapters is not so much about becoming part of the NDPA, which we like, but what it is and this is on your table. I did make the printout. Drowning Prevention Coalition, Drowning Prevention Task Force, Drowning Prevention, whatever you want to call it, is getting a group of people in your area to come together and tackle drowning prevention and water safety. That's all it is. And for your group, whatever you want to call yourselves, if you want to become an NDPA chapter, then we will help you develop and promote and get the resources out to yours. Because we have, along with the Arizona Drowning Prevention Coalition and the Broward County Drowning Prevention Task Force, just our task force alone has over 180 members. So I send out information to those folks, and then they disseminate it out to their folks. But I have on a regular basis anywhere from 25 to 50 people who show up on a regular monthly basis just to talk about drowning prevention. And this is our strategic plan. That's all this is. And you'll see all the organizations that are like the lead. It's not the only one, but it's the lead agency. And you'll see that Fire Rescue and the Sheriff's Office and hospitals and the Red Cross and the YMCA and our Children's Services Council and our county parks and our city parks and our Department of Health. And everybody is involved in this plan. Your plan may not look like this, but this is what ours looks like. And then you can take it, steal it, use it, change it. I have this as well, but I just wanted you guys to see what we do in Broward, and we still have drownings. And this is what we're doing. And so what I would like, if you guys wanted to create your own drowning prevention task force, that too is online, how to create your own drowning prevention task force. All it is it's another committee. It's another group that just to get this together once a month or so But you need somebody to champion that. Because if you don't have someone like me in your community, and maybe it's you, or maybe you know somebody, but if you don't have someone to champion it, then it'll just be another, and nothing will happen. But there has to be somebody who takes the lead and makes sure all of this, or whatever you guys decide to get done, gets done. And then hopefully your drownings will go down too. One of the things, where am I at? Go. One of the things that we have in our task force is that because I chair our child abuse death review team, whenever there's a drowning death, this is what we get. So because we work with the county, we get the county medical examiner, who's also on our task force. This is a copy of our medical examiner that gives us every time there's a drowning. And you'll see it's quite extensive. Here, 3 pages. This is 1 year. What year was this? This is 2010. We had 8 drownings of children under the age of 4 for this year. And here's what you get. You get the case number, the name, the manner. The manner is homicide, death, or homicide, accident, suicide, undetermined. I think that's it, right? Yeah. So that's the manner. You get the primary cause. Here is drowning. One of the things that we found out here, and one of them you can't see here, it says asphyxiation. So when I call the medical examiner's office and I say, can you pull up all the drowning deaths, they'll pull me up all the drowning, but asphyxia wouldn't come up. So I have asphyxiation due to drowning, but it doesn't come up in my drowning report because it's listed as asphyxia. This is 2010. I brought this for a reason. They don't do that anymore. Now, drowning is a drowning is a drowning. So they don't have it listed as asphyxia. You get the age, the race, the sex, the date and the date of the death, which is not always the date of the incident. And then you get the pathologist who was on that case. And here we have, I don't know how many pathologists on here, but there's a lot. In Broward County, we have 1 person assigned for children 10 and under. This is Dr. Wardak. He's the only one who does autopsies now. So he does more autopsies on drowning victims than anybody else in the country. Now, what I wanted to show you is, if I can find it, the things that we get when we investigate a drowning. And I go and I train the child protection investigators on how, where is it? What to look for when they go into these drowning cases. And I'm not finding it. All right. Anyway, remember I told you there's only like 5 or 6 things here, right? When we do an investigation of a drowning, there's about 40 things that we ask for. Not these things. This is important. We got their age, the race, the manner, and the date. But when we go in and investigate, we get a great big spreadsheet. What day of the week? Was it a weekend? Was it a holiday? Who was home? Was it the mom? Was it the dad? Was it the grandmother? Was it a babysitter? Did they know CPR first aid? Did they apply first aid? Was the pool green? Almost always the pool is green. So were there any priors in the family? I want to tell you a rather startling statistic. In Broward County in the state of Florida, almost 70% of the children who drown, their parents had prior allegations of abuse and neglect. So there's a correlation between abuse and neglect and drowning in the state of Florida. But remember, that's 70%. That means there's 30% where this sort of thing would come in handy to get the information out. It's all with the messaging. So you guys, what we'd like for you to do, go back and find out who's drowning. You sort of get a picture here who's drowning, but you don't really know the why. How did this happen? Who was at home? In almost every case, the parents were on drugs or alcohol. In almost every case, the child was in the water for almost 40 minutes. in a lot of the cases, the parents didn't know how to swim, so they didn't go in after the babies. Guess where the babies were? The shallow end. Their fear of the water was so strong, it overtook them, and they did not go in and get their babies. Instead, they stood at the edge of the pool and screamed for help. When I tell you that every second counts, because the longer they're left in there, the less likely that we're going to have a positive outcome. So, okay, where am I at? Sorry, I got about 5 minutes. Okay, here's our partners. Okay, we see that. There you go. I want, okay, you guys have to be, give me 1 minute. So we addressed this, and you guys can do the same thing. Here it is. No, it's not. Is that if we know that a parent, or if we know that 70%, this is Broward County, remember Fort Lauderdale, if we know that 70% of our children are coming, that are drowning, are coming from parents where there's already allegations of abuse or neglect, then why don't we hit that at-risk family? Right? So you guys need to find out, because it's more than just this. It's more than the medical examiner's report. I mean, that gives you some detail, but it doesn't give you the data to dig in to find out. Because if we just have this, we're going to hit the black community because it says black. But you know what? Most of our drownings were coming from the Haitian community. Okay, yeah, those babies were black, but you know what? They were Haitian, and that's a completely different neighborhood. So you guys need to find out, if you're interested, to find out who's really drowning and why, and dig into that. So we thought, well, let's hit that at-risk family. Anytime an abuse hotline number is called in for whatever reason, the child protection investigator goes out and investigates that allegation of abuse or neglect. Every time they go, they take a water safety survey with them, and they spend 2 minutes going over this form. In Broward County, we get 12 to 1,500 calls a month for allegations of abuse or neglect. So they're going out and doing this. They're also taking with them door alarms, because we know that 90% of the children who drown walked out of the house without the parents knowing about it. I can't afford a pool fence, but I can afford door alarms because they're only $9 and I get 2. So I have one for the front door and one for the back door. So they fill out these forms. They give them Red Cross information. They give them information for Swim Central. So Swim Central is a program where we take kids from pre-K and kindergarten from the school to a pool for 10 days of water safety education lessons. We do about 30,000 of those kids a year now, and it's in partnership with the school board. Even though this is not our target group, because it's the 2 and 3-year-olds who are drowning, not one child has drowned that's gone through the Swim Central program. That's 30,000. We started in 1999, so that's a lot of children that go through that program. And since their names are in the database, we know we can track them. Every time there's a drowning, we can go in and see if they're in there. So that's another program that, as a community-wide thing, if you're a YMCA, a Boys and Girls Club, a Parks and Recs, if you can partner with a daycare or a school board or somebody to have your kids come in and get these 10 lessons, you can call USA Swimming, Make a Splash, and they will help as well get that program. It's a similar program that goes on all over the country. And so I wish I could find that stupid report for you that shows I really want you to see that. I want you to see the data that we collect when a child dies. And it's pretty much the same thing as what's collected when an adult dies. And it's investigated. Most of our drownings around the country are not investigated. Only 30% get called in to be investigated. In Broward County, we call in 100% of them. So on your things too, every year the NDPA has a conference. This 2014 is coming up. It's in Orlando. We have Chuck Wilgus coming from USA Swimming. We have Dr. Peter Antevi, who's developed a new hand thing for dispensing medication for first responders. And so he'll be there. We have our Dr. Wardak, who's coming to talk about the physiology of what happens when a child drowns. We have more panels. Anyway, it's very similar to this conference, but it's a specifically drowning prevention and water safety for that. And then our water watcher tags. So these are the things. If you guys want to create your own coalition or task force or whatever you want to call it, we have all the materials and the resources to help you put that together. And I can make conference calls. We can do whatever you would need, or if you need anything, we would be there to support you, because we basically don't want any more drownings. I mean, it's 100% preventable, and somehow drownings just keep getting a pass, and no one's really looking at it like they should, and we need to look at it differently than everybody else does. So let's see, is that where I'm at? Oh, that's it. Okay, am I doing good? Are there any questions? We're good? Clear as mud, right? Please take all the stuff that's on your tables with you so that I don't have to take it again. One more thing before I go. The next session is a program that we're just developing and put together. It's called the Seal of Safer Pool Programs. And it's for Class C pools, which is the commercial pools that are usually non-guarded, like hotels, apartments, resorts, things like that. So that's I didn't get into it too much here because I've got another hour at the next session. But if you're interested in that program, then stay for the next one. But no questions? No? Good? Oh, you go on to the website.
Kim, I believe the question was, how do you become a member?
And it's very easy. We have the membership packets out here, but if you go to the ndpa.org, I've said that 1,000 times, it's got its own little tab. You just click it, and it'll take you right to the membership program. Okay.
I think another question might be, I saw some people searching, and I know there were only a few of these on the tables. If they did not have enough of these brochures...
I have them out at the table.
Okay, so if you did not have enough of these brochures on your table, and they were the Smart Water Babies or the prescription ones that she was talking about, they are out on the table in the lobby area. Any other questions?
Very good.
All right, well, thank you, Kim.
All right, thank you.